Hi, my name is Lauren, and I am one of the nurse practitioners taking care of you here at Choice. We thank you for trusting us with your care. Please watch this important video about an abortion with Choice. In this video, we outline the process of receiving your medications, what order to take them in, and what to expect when you take them. You will be receiving one package in the mail from our partner pharmacy, Honeybee, which has all medications and additional supplies if you ordered them. It will contain the two medications you need for the abortion process, mifepristone and misoprostol. Mifepristone is the single pill in the box, and misoprostol will come in a green bottle. Your package will also have ibuprofen to manage pain and ondansetron, commonly known as Zofran, to manage any nausea associated with misoprostol or with the pregnancy in general. Once you have received your medications, you will need to decide when and how to take them. Please be sure you are starting your medications before the date we provided you. The first pill you will take is mifepristone. This medication blocks the pregnancy hormones and stops the pregnancy from continuing. Mifepristone is a pill that must be swallowed. Misoprostol is the second medication in the process. This medication causes cramping and bleeding and makes your body pass the pregnancy. You have two options for how to take misoprostol, and both are equally effective. Your first option is that you can insert misoprostol vaginally. This can be done as soon as 6 hours after swallowing mifepristone, but you can start up to 48 hours later. At the designated time, you will place all 4 tablets of misoprostol into your vagina and push them back as far as they can go. You will lie or sit down for 30 minutes to allow them to dissolve. After 30 minutes, you can get up and walk around. Leave the pills in place and don't remove them. However, if the pills fall out, don't worry, it's okay to throw them away. We recommend the vaginal method for those people who are already experiencing nausea related to the pregnancy or who are hoping to start the process a little sooner. Your other option for misoprostol is buccal, or between the cheek and the gums. This method can only be started 24 hours after swallowing mifepristone, and you can begin up to 48 hours later. For this method, you will place all 4 tabs in your mouth between your cheek and your gums and let them dissolve there for 30 minutes. After 30 minutes, you can swish your mouth and swallow any remaining medication. This method we recommend for people who are not comfortable inserting pills in their vagina. We also recommend taking a dose of ondansetron 30 minutes before administering misoprostol this route. Please note, you will receive 8 tablets of misoprostol in your shipment. If you are less than 9 weeks pregnant, you will only be using 4 tablets and save the remaining 4 to use if we tell you to. If you are 9 to 10 weeks pregnant, you will be doing a second dose of misoprostol 4 hours after the first one via the same route you chose. Once you receive both packages and have decided what route you will take misoprostol, please let us know the date and time you will take each. We will schedule your follow-up appointment based on the date and time you take misoprostol. First, you will take your mifepristone. We do not expect you to have side effects after you take this medication. If you start to have bleeding, that's okay. Please continue on with misoprostol as directed. You will take misoprostol at the designated time, and 30 minutes after you take it, we strongly recommend starting on a schedule with the ibuprofen provided to you in your medication pack. You should take ibuprofen every 6 to 8 hours as needed for the first 24 hours. Misoprostol is the medication that causes the cramping and bleeding and may come with some other unpleasant side effects, including nausea and vomiting, diarrhea, stomach or back pain, and even a low-grade fever. These should all resolve within 24 hours after taking misoprostol. We do expect you to have bleeding during your abortion process, which can vary from person to person. We recommend that you use pads during this process, and you should not use tampons or menstrual cups. If you do not have much bleeding at all, such as not soaking a single pad in 24 hours or only having spotting, please contact us. Here is a guideline for how to define bleeding during an abortion. If you are bleeding too much, please contact us as well. Bleeding too much is defined as soaking through more than 2 regular maxi pads per hour for 2 hours in a row, or passing clots larger than the size of a lemon. The heaviest bleeding will be for the 24 hours after misoprostol, and you may have continued moderate to light bleeding for a few days or even spotting for a few weeks. This can be totally normal. We will follow up with you via text message 3 days after you take misoprostol and again 4 weeks later. We expect you to reply to our text messages within 24 hours of receiving them. Please be sure not to take a pregnancy test until we direct you to do so at your 4-week follow-up, as pregnancy hormones take some time to leave the body. We acknowledge that a medication abortion comes with a lot of different feelings and may be an unfamiliar process. We provide you with all of the resources and information you need to take care of yourself physically and emotionally as best we can. Please be sure to review the links we sent you in addition to watching this video, as it has important information and answers to most questions you may have throughout the process. We at Choix are here to support you through this, and we thank you again for choosing us to take care of you.